A very good day to you and a warm welcome to your enlightenment program, The Economy and Inside Agriculture, where we focus on topical issues that will help inform economic decisions for the well-being of citizens. I am Ile Emeje. Technology innovation has become relevant to the growth and development of nations of the world, essentially impacting sectors of economies. Consequently, the deployment of technology into the health sector, particularly in medicine, is significantly reshaping the healthcare economy by driving toward value-based care, increasing operational efficiency, and reducing long-term treatment costs. With the emergence of artificial intelligence, AI, expert opinion noted that by 2026, this current year, AI is expected to move from experimentation to mainstream adoption, potentially generating $200 billion to $360 billion in the savings in the US alone through automation and improved diagnostics. While initial implementation costs for technologies like electronic health records and AI be as high as you may think, they offer significant long-term returns on investment (ROI) by reducing administrative burdens and minimizing medical errors. According to these experts, the key economic impacts, which include, among others, the reduction of costs, and is believed to standardize workflows and automating routine tasks such as clinical documentation and billing, is also essential. Meanwhile, the question that is demanding for an answer in the minds of many Nigerians and citizens across the world is on how AI and technological innovation would, in real terms, improve the general living standard of citizens. And so, joining me on this episode to bring us to the understanding on whether or how technology innovation or AI can help inform economic decisions for the growth of the nation is the founder and the chief executive officer of MedXverse and the creator of Lexi AI, Mr. Timileyin Sheyi. My guest is joining me just after the promo. We'll be back in a minute.
We are a nation blessed with people of diverse cultures, religions, languages, and opinions. It is ironic that we are now being ripped apart by our greatest strength, our diversity. We have allowed intolerance, insensitivity, bigotry, and nepotism to blind our vision of the greatness we can achieve working together as one. We may not have the same culture, nor religion, nor language, but we all belong to the same nation by the divine will of God. We did not choose to be Nigerians. Nigeria chose us. This nation is our divine heritage, and if we open our eyes, we will realize that what divides us pales in comparison to what unites us. And by the comparison and conciliation of our differences, we will grow until our differences disappear. Our unity cannot be willed by mere declarations, nor do we get unity by ignoring the questions that beg for answers. We must celebrate our diversity and debate our differences without fracturing our unity. Our strength is not in our numbers, but in our unity, because even the weak become strong when united. Nigeria unite.
This message is brought to you by Abuja Broadcasting Corporation, owners and operators of Aso Radio 93.5 FM Abuja, Aso Television DSTV Channel 392, Star Times Terrestrial Channel 127, Free TV Channel 507, People's TV Channel 285, and UHF Channel 30.
In case you just tune in, you are on to your enlightening program, The Economy and Inside Agriculture, and our guest on this episode of the program is the founder and chief executive officer of the MedXverse and creator of Lexi AI, that is artificial intelligence, Mr. Timila Nshei. He's already here with me in our studio, and we will be looking at the topic we caption as deploying technology innovation across medicinal value chain, the economic impact. Mr. Shea, you are welcome to the program.
Well, thank you so much.
All right. We are all aware of that. Experts say agriculture and the new technology are positively correlated, and that this correlation will lead to a positive impact on the general economy. So what can you tell us on agriculture and the health sector to start with?
All right. Basically, when we talk about agriculture, we both know that a nation cannot survive without food production.
Yeah.
And basically, we talking about linking this agriculture into the healthcare in terms of foods. Various non-communicable diseases like diabetes, hypertension, that are more rampant among citizens today. Most of them are actually attributed to the food we consume. And this has actually helped us to understand more about lifestyle and nutritional medicine. So the food we eat lately has been contributing a lot. And at the same time, a nation who does not have a standardized agricultural sector is actually going to have a problem when it comes to health. Because every sector depends also on agriculture in terms of food production. And then when the food production or the cost of production of food or the supply chain is actually being affected, definitely is going to affect the health of the citizens, which are solely relying on the production from the agricultural sector. So I'm saying in essence that the food that are being produced and the way they are being produced, how they are being transported, everything has impact on the health. So the most important thing is to have an integralized and integrated lifestyle medicine, something that help individuals to eat appropriate food. You know, after harvesting crops and all that, the most important thing is getting to the right people and people consuming the right ratio of food, because every of this ratio of food or different type of this food contributes solely to the health also. So because the food we consume contributes to our health.
Now,
the agricultural sector also helps in the healthcare sector.
All right. Thank you for establishing that. Now, you are the creator or founder of Lexi Artificial Intelligence, which is a technology innovation-based initiative. What gave you the motivation? What is it all about?
So Lexi is a personalized medicine chatbot assistant. So what Lexi does is Lexi is like your daily friend. If you want to eat any food, there are many people who just consume food without understanding even what they are cooking. Some people use both saturated and unsaturated fatty acids to just cook. People just want to eat, but without understanding the content of what they want to eat. So Lexi actually has more than 15 functions. So number one, if you want to eat any food, or let's say you are currently on medication, and you need someone to be reminding you that, oh, you need to take medication. Like for example, I want to take paracetamol 8 a.m. every morning. So just set your reminder with Lexi. Lexi will message you on WhatsApp every morning that you need to take your medication now.
End of a reminder.
Yes, that's one. Number two, if you are currently being managed for any disease or any problem in the healthcare sector, you can discuss with Lexi. Lexi will get the prompt from you, and Lexi will recommend daily meals which you can eat. For example, like today, as a Nigerian, you are currently being managed for hypertension. Please don't take this so today. Don't eat this. Try today to combine, maybe eat fruits and consume this so food. So Lexi does that. Lexi also gives you the access to book consultations with doctors that are licensed in Nigeria. Okay, so you can book appointment instead of going to maybe hospital some cases, or maybe you just feel like you need to get some more information about your health, or if what is happening to you will warrant you to see a doctor. Lexi does that too. So it's a precision medicine chatbot that helps you to know what exactly is wrong with you, what could likely go wrong in the next few days, and if anybody is currently having any mental issue, health issue, so there's a daily routine check for Lexi. So Lexi chats you every morning to know if you are fine or not fine. If you are currently having any problem, you can discuss with Lexi. At the end of the day, by Sunday, Lexi will analyze the chart for you that throughout this week, I discovered you've not been feeling well. And I think you have some mental stuff. Do you want me to connect you to a mental doctor or a mental health specialist? Or let's say someone who has been experiencing some kind of depressive mood states and all that. Lexi can help you to connect you with various doctors who are actually in these sectors. So Lexi is a personalized healthcare assistant. It's a chatbot. It's available on WhatsApp. And Lexi also helps in helping people to arrange their health records. For example, if you chat Lexi now, okay, hi Lexi, I'm currently having, let's say, headache. Can you please find a solution to this, or what might actually be wrong? So basically, when you are boarding with Lexi, Lexi will get your location, where you stay and all that, because there are some disease or disorders that are articulated to the areas where people are staying, the environment. So we let you understand that, okay, maybe according to the weather, according to this, so because we feed Lexi with the current data that are available, either weather, in terms of healthcare, files or data news and all that. So Lexi will tell you that this is what is actually happening in your area, and because you are currently doing this social job also, there is a high tendency that maybe because you are standing for long hours might be the reason for the headache. So Lexi will give you what to do. Okay, you can try to relax, maybe eat, drink water, and maybe take a good nap. So Lexi will give you suggestions on what to do. Okay. And if you try that, it doesn't work, go to Lexi again. Lexi will tell you, all right, since I give you an idea or suggestions and it doesn't work, let me connect you with your doctor then. So when you click on book appointment, then it links you to MedXverse. Okay. So that is where you have access to all the licensed medical practitioners in Nigeria.
Lexi.
Yes.
So now I can consult Lexi.
Yes.
You know, I came in here since about 6 o'clock, and I've been sitting down working.
Yes.
And I'm feeling good, and I will talk to Lexi, and Lexi can prescribe. Can Lexi prescribe some food items for me, or maybe a food chain? You have been sitting down.
Yes.
You need this. You need fruit. You need apple. You need this and drink. Can Lexi do that?
Yes, Lexi can even order food for you.
And pay.
You will pay.
I will pay. Lexi will pay.
So
Lexi cannot pay.
Yeah, Lexi will not pay. But you pay to Lexi. Lexi can order the food, and then a dispatch rider will actually call you, because Lexi can request your access for your location. So as we are here, let's say I chat Lexi. Hi Lexi, I'm hungry, and I'm currently on this social medication, and I need to take a meal before this. Let's say you ask you, what are you being managed for? If you are being managed for maybe hypertension or diabetes, Lexi will now order food that you can eat because you currently have that condition. So you give Lexi access to your location, Lexi will send it and link it to our backend. Then the dispatch rider, the restaurant that is ordering the food from and everything will get the detail that this meal is actually for an hypertensive patient, for diabetic patient. It should be there should be low cholesterol and all that. So they make a very good and healthy meal and dispatch it even before we finish the program. Dispatch rider will call you that I'm at the doorstep. Can you pick your order?
This is very good. Yes. But it's Lexi functional now. It's a new technology because some of us are hearing for the first time.
Yes, Lexi is currently functional now. Lexi is functional. But we are launching the MedExverse app next week.
Okay. Now, you read medicine from one of our famous universities in Nigeria.
Yes.
Why are you thinking of traveling abroad to go and make dollars? Why Lexi?
So one thing I believe is that right from the time I've always been thinking of anytime I'm done with any program I'm doing, I'm just running and all that. But one thing I realized lately is something happened to me. I was having an exam one time, and while preparing for the exam, I lost my dad. And it was so crazy because I was actually in Southwest that time, and then I just received a call around 4 a.m. and they said my dad is dead.
So sorry.
Someone who called me yesterday, and I currently know he doesn't have any health issue and all that. So what happened, and the reason why he was able to die, the death is actually preventable. It's preventable, but the basic issue is that in my hometown, we currently have no access to a standard hospital, which is one of the number one problem because there has been increase in mortality rate in my hometown, and it's a big issue. And within the period when my dad started having that issue in the midnight, as I was told by my mom, and my dad just stood up in the midnight that he's going to hospital. I said, so when I was getting the information from my mother, and she said that my dad just woke up around 11. I said, I need to see a doctor, but there's no doctor. So he's currently feeling dizzy and he couldn't drive. He had to drive himself. And on his way to the hospital, then he died. In fact, that place is not even an hospital, it's a clinic.
A nearby clinic.
It's a nearby clinic. It's not handled by a medical practitioner. So with something like that, it's actually preventable. Why? Because he shouldn't have died like that, because within that period when he started having that symptoms, if we have access to something like Lexi will tell you that, now I think you need to see a doctor right now. So the doctor will now have a video call with him. Sir, you are not looking good, and this can you please travel or do something? Then one of the things we're also planning in future to integrate with Lexi is ambulance. Okay, so for example, someone who is actually having shortness of breath at home, that does not have any family or someone that is actually staying in home, can just chat Lexi, please, I need an ambulance right now. And the Lexi will make a call and send the direct live location to the ambulance. That this person is currently being in this location and does not have any support or anything. Can you please go to this location and rescue the person?
Irrespective of the time.
Irrespective of the time, they will get there. So, and one of the things is that most of this technological integration will actually be more standard if there is also support from government. Because if we have enough infrastructures in place, it will be easier to deploy ambulance to any location in short response in time. In foreign countries, if any citizens have any issue, it's more easier to, for example, US to dial 911. And 911, you have access to either a police, you have access to ambulance, you have access to everything there. But in Nigeria, maybe there have been some structures in place actually by the federal ministry, and they are actually working very well. But some Nigerians generally have actually not understood how some things actually work. And one thing we are integrating more on Lexi is to be able to provide instant medical support. So, for example, someone who is at home, staying alone, no friend, no family, or a grandma whose children, everybody has traveled outside the country, even the caregiver is not around and all that, and the person is having shortness of breath. So definitely the person can still chat Lexi, that Lexi, please, I need an ambulance now. So even if the person is an amputee, and we can always solve some of these issues using Lexi. So my dad's death is actually preventable, and that thing actually created a lot in me. I feel like there are many people that this might have actually happened to who do not have that access to even speak out, or even have access to think about a digital solutions or a technology that can solve all these issues. So I took my time to start studying what will actually work and how can we solve this issue. Then we set up a team, we started working on it, we started making research, and we discovered that many people actually die today in this country, and the deaths are actually preventable. Like
cheap death?
Yes, cheap death. They just die, and many times we think most deaths are actually linked to God. No, because there are a lot of things that usually happens in the background that most people do not actually pay attention to. For example, Nigerians generally we are stubborn about some things. Some people, when they have issue, if that problem does not stop their daily activity, they will never want to talk to a doctor. And some people, when they have issue with their health, they prefer going to a nearby pharmacy or a chemist on the street just to buy medication, which is very wrong. It is very, very wrong, because sometimes most of the medications you get might actually not be effective enough for what is currently going on in the system. So more reason why a licensed medical practitioner need to be in place somewhere. So that's why we created MedXVAS. Okay. So we created MedXVAS such a way that no matter anywhere you are in this world, anything you have, any issue you have access to doctors on the app. And all the doctors are licensed, and then you see their ID, registration number, license number, everything on the app. So as to make sure that these people are actually legit, standard, registered, licensed, and all. So those are the aspects. So basically, using my dad's death, I feel like there are many people who actually experience that, and they do not have that chance, because we think most deaths come from God. We link everything to God, and it shouldn't be, because some deaths are actually preventable. So to prevent deaths occurring, we now created Lexi and MedXVAS. So Lexi helps you incorporated with MedXVAS. For example, you want to book appointment, you need a food, you want to order food, you want to order medications and all that. For example, let's say a family member is currently in an hospital and they need to get medication, and that hospital do not have those medications. You can send the list of those medications to Lexi. Lexi will analyze those medications, every details, and order them for you. So Lexi will order those medications for you. You just need to pay. You get the total cost and everything. Just pay. Then you give Lexi access to your current location, and then you get the medication and everything delivered to you in a short period of time.
Okay. Now let's look at the cost.
Okay.
That is, look at the effectiveness of Lexi and MedXVAS.
Yes.
In Nigeria.
Yes.
Given the technological issues that we face day in and night. I ask you a question, say, what gave you the courage? Don't you think, as a medical personnel, a lot of people now are going to read courses like nursing, BSc, medicine and surgery, lab science, and the rest, you know them more than I do, because that is your field. Why are they reading these courses? Because they want to jackpot. In our own balance here, they jackpot. Why are you not thinking, do you think that you want to remain in Nigeria and not getting dollars, or what do you think?
So, okay, I think there are two questions in that question. Firstly, let me address the first one. But basically, I think the first issue people have generally is that there is a high rate of poverty in Nigeria. And the kind of healthcare people get is according to their financial status, which is not meant to be. For example, some people don't want to go to hospital because they feel like, if I go to hospital, this 20,000 in my account now will disappear, and I don't know when I will see another 20,000. So some people just feel like, out of this 20,000, let me just go to sister something that is selling medicine somewhere, one medicine store, then just get maybe 2,500, 3,000 medicine. Then the person believe that with this, I will still take this medication and still relax. At the same time, it really doesn't work that way. Because at times, those medications might just solve those issues temporarily. So they will just relieve you of the symptoms, but might not solve the exact problem.
The root.
So basically, the high costs of the high rates of the cost of living, the high cost of living, and then the inflations in the healthcare sector lately. There is increase in medication costs, hospital healthcare costs, and all that. So people, I've seen someone that said, "I prefer dying at home than going to hospital."
Oh my God!
And that woman, I now asked her, "Now, why will you say something like that? Why will you utter that statement?" He said, "Okay, now that since they've been here in the hospital, that they've been spending money. That this money that they are spending, if she's actually seeing those money in her account, that she'll be needing elderly." And I said, "Okay." And I said, "But there are some situations that are unpreventable sometimes, in terms of you coming, nobody knows the time to get sick, and that's one thing, because it is so someone doesn't get noticed, and basically the people generally, for example, during my research, I asked some people that, why don't you go to hospital? You are sick. Why don't you go to hospital?" And this person was like, "No, before I go to hospital now, they will start billing me. I will even need to wait for long hours before they attend to me and all that." And I feel like, no, it shouldn't work this way, because there are standard hospitals actually that can give you standard emergency care. So I just started thinking lately that, okay, how can we provide solutions to all these problems? How can people be healthy using technology? And how can we bring an innovation in terms of healthcare that will solve all these issues
and accessible to all,
and accessible to every individual on this planet? So that's the reason why we created that. Then the other question in terms of JAPA or no JAPA is that basically I think it's an individual something, but one of the things is that the problems in healthcare in Nigeria cannot be solved by the government alone, and at the same time, nurses, doctors, laboratory scientists, dietitians, everybody need to work together to build the healthcare sector. If everybody keeps traveling, migrating, relocating, and all that, then there will still be shortfalls of healthcare providers in the country. So definitely people will still keep on dying. So one thing I realized is that any medical course is actually a sacrificial course, is a selfless decision. So of course people need money, everybody need money, we need money, and getting money is not easy, based on what the government is actually the government is also trying at the same time. But if you compare the salaries of the healthcare providers in Nigeria with other countries, there's a huge difference. So that's one reason why the JAPA syndrome will not stop. But the only thing that can be done is encouragement, to encourage people to stay.
Let's look at the cost implication. Just give an analysis now that a woman was sick and she said she preferred to die at home than to go to the hospital. Why? Primarily because of the cost implication. You'll be paying, the bills are coming, you buy literally almost everything, and then to talk about the impact of the drugs on the person. Now, you have introduced Lexi and MedXverse. What have you put in place to address or to take care of the cost? Now, talking about cost again, is Lexi and MedXverse pocket friendly? Do you think this would not be out of the reach of the poor in the society? How do you want to bring this together?
All right, so basically it took some years of research to be able to know the average amount of money that people actually pay, and basically one thing we did is that even you don't need to have much money before you can have access to.
You think so?
Care. Yes. So that's what we have on Lexi and MedXverse. So on MedXverse, so we have currently we have over 300 licensed doctors on MedXverse. Yes.
300?
Yes, 300, and we are still hoping to get more. Our target is actually 5,000.
5,000 doctors, medical doctors.
Yes.
on a platform
in Nigeria, Nigerian trained.
in Nigeria.
Nigerian trained. We are currently working with Nigerian trained only for now, because MedExas is actually built for Africa by Africans, we Nigerians generally. So all the doctors on MedExas, they are licensed and Nigerian trained
Doctors.
So what we did is that the consultation is very cheap. Basically, if you go to some hospitals and when you want to consult, you pay 10,000, 15,000,
Consultation
20, 50, 100, some 150.
So where you go to?
It depends on where you want to go to. So most people just say like, Alan just owed like, let's say 50,000 in my account, and when I get there, then I will think on. So most times, some people actually discharge against medical advice in the hospital because of cost. For example, let's say I'm earning 70,000 naira now as a month.
Yeah.
And when let's say I went to the hospital for treatment, and I'm already spending like 100,000, like already spending my whole salary, and I have to compare to borrow money and all that. Next time when I'm sick, I will not want to go to that hospital. I want an hospital who can provide a cheaper care.
A pocket friendly.
So now we now decided that, okay, what can we do to solve this problem? So on MedExas, so no matter where you are in Nigeria, you are only paying 5,000 naira for consultation to the doctors.
Are you sure?
I'm definitely sure. So when you pay that amount, then you have access directly to the doctor. You book an appointment, then you and the doctor can have either video call, a voice call, or chat. So we integrated a chat. So inside that chat too, it's easier for the doctor because we integrated the technology such a way that the doctor can issue prescription to you in form of PDF. You can even send it directly to the pharmacy, or we order for you directly. So, for example, parents who actually have children abroad, but they feel like, let's say, for example, the mother is sick and they want the mother to have access to healthcare, so they can actually use either Lexi or so. Lexi is a personalized healthcare assistant, as I've said, and monthly subscription on Lexi is just 950 naira.
Say it again.
950 naira.
Below 1,000. Okay, don't worry. We take a quick break now and we'll be right back. When we come back, we are going to know whether 950 naira below 1,000 naira can solve that medical issues. Stay with us.
We are a nation blessed with people of diverse cultures, religions, languages, and opinions. It is ironic that we are now being ripped apart by our greatest strength, our diversity. We have allowed intolerance, insensitivity, bigotry, and nepotism to blind our vision of the greatness we can achieve working together as one. We may not have the same culture, nor religion, nor language, but we all belong to the same nation by the divine will of God. We did not choose to be Nigerians. Nigeria chose us. This nation is our divine heritage, and if we open our eyes, we would realize that what divides us pales in comparison to what unites us. And by the comparison and conciliation of our differences, we will grow until our differences disappear. Our unity cannot be willed by mere declarations, nor do we get unity by ignoring the questions that beg for answers. We must celebrate our diversity and debate our differences without fracturing our unity. Our strength is not in our numbers, but in our unity, because even the weak become strong when united. Nigeria unite.
This message is brought to you by Abuja Broadcasting Corporation, owners and operators of Aso Radio 93.5 FM Abuja, Aso Television DSTV Channel 392, Star Times Terrestrial Channel 127, Free TV Channel 507, People's TV Channel 285, and UHF Channel 38.
right, it is an interesting episode of the program, The Economy and Inside Agriculture, and today we are looking at medicinal value chain and looking at technology, particularly AI, and how we can deploy technology to accessing seamlessly medical care. And my guest has been the founder and chief executive officer of MedXverse and is the creator of Lexi AI, Mr. Timileyin Ishe. Before we went on the break, you were trying to explain to us that Lexi and MedXverse is as cheap as anybody can think of.
Yes.
You explained that a lot of people will choose to remain at home to even die than going to the hospital because of the cost. And that is what we run through the minds of all Nigerians. Last 2 weeks, somebody around me was sick. She had cold in Qatar and she wanted to get a simple cough medicine. And when she got to the pharmacy, the cheapest she could get was 22,000. 22,000, one 50,000, another one cough syrup.
Okay.
That is the situation we find ourselves. And now Lexi is here.
Yes.
MedXverse is here. Tell us what makes the difference in terms of cost and accessibility.
Okay.
In case someone is out there and we also download Lexi, want to have Lexi as a friend to talk to, how do we go about it? Cost first.
Okay, so in terms of cost, actually in Nigeria we are part of our problem. At the same time, we are still part of our solutions. So in terms of that, I just need to explain that there are medications those cough medications are very cheap, but we live in a country whereby something costs 2,500 naira, for example. You charge 25,000 naira for it.
At all.
And we think, and every time we blame government. Everything is not government, it's an individual issue. Because the government are not the one controlling the prices. And that's one issue, because if there is price control, people will not be complaining about high cost of healthcare and all that. So, cough medicine is just like maybe 2,500, 3K, 4K. And let's say because of the inflation lately and all, maybe 5,000 naira.
22,000, 50,000.
So that's way too much. That's way too much. So one of the things we did on MedXverse is that, especially with Lexi, when you come on Lexi, if you are prescribed a medication, we are working with the pharmacies that provides the cheapest and standard medications. Okay. There are some people who generally actually just overpriced their product. They just put huge amount of stuff to make
it's profiteering.
Huge amount of profit, and this is actually affecting people generally. And there was last week I went to get a medication for my mom, and then I got to one pharmacy. It was being sold at 11,250. So I got to another pharmacy. So when I want to go back, I bought it. When I want to get that medication again, they said it's exhausted already. So I went to another pharmacy. I got that same medication, 7,250.
See the difference?
So the difference is more of like 4,000 naira.
It's much.
So that 4,000 naira can actually purchase another medicine.
Yeah.
So one thing we did on MedXverse is that the companies, the pharmaceutical companies we have on board, people that are vendors that partner with us and all, we ensure that the prices are actually being controlled. They are things people can afford. Because we can't create a solution by providing another problem. So if we say we are reducing costs from the company and yet people are still finding it difficult to pay, then it's a general issue. So I said it's an individual problem because there is actually absolute no price control, which is a basic issue. But things are actually not as expensive as people actually thought. But there are various vendors who just put high price to their product, which is affecting people. So some people just feel like, for example, some people believe that instead of they even paying huge amount of money to get medication, why can't they even use herbal medicine? Just cook, just package everything and consume it. And this is one of the leading costs of kidney issues by consuming herbal medications. It's one of the leading kidney issues lately by consuming herbal medicine, because most of the medicinal plants, they actually need to be controlled and all.
That is when it is not controlled.
When it's not controlled, so people just take different leaves. Some people don't even have idea of what the leaves actually work for. They just feel like if they combine 1 or 2, 3, like this one out of the 2 leaves will work. So what about other leaves? Are they also functioning? So they will definitely be working on something on the body. So most of the time they target some organs. So it's a basic issue. So in terms of the cost, for example, Lexi monthly subscription, we have 950 naira for basic user, and we have 2,500 for people who can actually afford that, because it's based on plans. Depends on what you want to be using Lexi for.
Excuse me, 950 naira
per month.
Per month?
Per month, yes.
950 naira per month?
Per month, yes.
Okay.
Lexi, to have access to that AI. So we use standard algorithm. We wrote billions of codes to make sure everything actually works together. Okay. So if you want to tell Lexi something Lexi is not programmed to do, Lexi will tell you, I'm sorry, I can't process this information because I am not programmed to do this. For example, you want Lexi to prescribe for you. Lexi cannot do that. Lexi need a doctor to assess you, prescribe for you, before he can order medications for you.
Okay, one thing, because of our time, we were making emphasis on Nigerian doctors, yes. Nigerian doctors. And a lot of people may not even believe in our doctors. What can you say about
Nigerian doctors are the best doctors in the whole world. And
say it again.
Nigerian doctors are the best doctors in the whole world.
How?
I can explain that. So basically, if we look at USA, some other countries and all, there is absolutely no country you get to that you will not see a Nigerian doctor. Basically, one of the reasons for the migration is actually the care from the government,
the welfare.
Because most times some people do not want to travel. They do not want to travel, but because many already have family already, they need to balance everything and a lot of.
So are you telling us to have confidence in the doctors you have?
The most important thing every Nigerians can do currently is to have confidence in Nigerian doctors. Nigerian trained doctors. Okay. Very, very, very standard.
Okay.
And because absolutely in Nigeria it takes about 6 to 9 years to study medicine in Nigeria and graduate, depending on the medical school and that. So, but Nigerian doctors are built with standard experience and then with real-time medical standard approach.
Okay.
So, for example, in some other part of the country, in some other countries, some people make consultations just by asking basic questions and all that. But Nigerian doctors know what to ask exactly and what exactly to do and how to handle patients and all that. And what even from the symptoms, from the presenting complaints, the doctors already know what exactly is happening.
Okay. Now let's go back to your initiative.
Okay.
Now, for those that want to download the app or to connect to the app, yes. How do you think we can do that?
All right, so we are launching MedXVAS and Lexi on next week Saturday.
Okay.
So by next week Saturday, if you check Google Play Store, Apple Store, you will see MedXVAS mobile application there.
Okay.
So it will be live next week Saturday.
Okay.
And then Lexi is currently on board, but if you go to Play Store to download MedXVAS, you can see Lexi.
Okay, so, and with the introduction of Lexi and MedXVAS, what do we expect on the medical sector as well as the general economy as we round off?
Actually, the project is actually to contribute to Nigeria economy, to also empower people too. At the same time, this will also empower doctors in Nigeria. And at the same time, it also helps us to develop the improve technology and healthcare more in Nigeria. And because as the world keeps advancing, we discover that AI is actually one of the most important areas that one of the most important initiatives and technology that people need to integrate and start learning, and people need to start using AI because it's very, very essential. And at the same time, I need to mention that the MedXVAS is actually there is data. There's data protection policy. It's HIPPA compliance. We have acknowledgement. We have letter of recommendation, acknowledgement, registrations from various government sectors.
And we can go on and go on and go on. Now, Lexi is here and Medex Verse is here to reduce, we call it the bureaucracy in assessing medical care in Nigeria, not just in Nigeria, but in Africa and globally. Lexi is welcome and Medex Verse is also welcome. And with that advice, we have come to the end of the program, The Economy and Inside Agriculture. The guest is the Chief Executive Officer of Medex Verse and he is the founder of Lexi Artificial Intelligence, Timileyin Sheyi. He is also a health tech entrepreneur building intelligent digital infrastructure at the intersection of healthcare, artificial intelligence, and financial systems in Africa. That's the one I love so much, financial systems in Africa. Mr. Ogunsaki, we thank you so much for coming on the program today. I'm hoping to call you again to at least to educate the people. You will come on and on and on. Okay, and to our audience out there, we appreciate you for branching off on today's episode of the program. I'm sure you have gained something. I am Ile, a major saying, have a good day.